Good morning to everybody. LN Ayurvedic PG Entrance Coaching Center. Today's topic is some of the important drugs mentioned in our classical science pertaining to head diseases or dravyas useful in zero virechana. What is virechana? Elimination or elimination of doshas from the brain. What do you mean by brain? What do you mean by mind? And what are the diseases in brain, which is related to the nervous system and related to the different systems. See, generally people will think that brain means related to the nervous system only, right? But no, it is not correct. In the sense, the diseases in the brain also linked with the diseases in the digestive system also. In Ayurveda, we are giving much importance to the ahara, vihara, aushadha and their related assimilation processings. Here, the diseases that are occurring in the digestive system held responsible for disease in the brain also. Let us see, but in 2nd century itself, Acharya Charaka, the father of medicine, mentioned the drugs useful in brain diseases linked with the digestive system. That we have to find out. Generally, disease in the brain means we will think with the nervous system, but it may be correct in certain angles. We have to give the basic or root level treatment in this. What is happening in the digestive system, we have to find out. Based on this concept only, Charaka mentioned certain drugs which are available even today, which are useful in different conditions. What are they? Let us see. In case of heaviness of the brain, see, generally people will feel heaviness in the brain. So we will go for the painkillers and we will go for the brain scanning and related investigations or examinations, whatever you say. So the moment a person is suffering from heaviness in the brain or heaviness in the head, in what way, at what level we require painkillers, or what is the line of treatment? Is it linked with only nervous system or linked with other systems like digestive system, etc., or not? You have to find out. Then you start the treatment. That will be the correct line of treatment. That is called root level treatment. Now, next one, Sula, headache, pain in the head. Even because of the phlegm disorders, or in Ayurveda, or because of the kapha, headache will be there in the brain, head, whatever you say brain, you say head. Is it not? So, you have to find out on which cause. See, what is the vitiation in the blood, vitiation in the nervous system, vitiation in the digestive system, you have to find out. Or whether there is an influence of the external climate or not, you have to find out. Then only you are supposed to start the treatment. So nowadays, immediately we are going for some painkillers. Nothing wrong in that in threat conditions. But what is the pathology there? In olden days, how without brain scanning, based on the examination, physical examination, based on the subjective symptoms, how they have diagnosed the disease and what are the drugs also we will come to know in this presentation. Penasa, rhinitis, cold, whatever you say generally. Chronic rhinitis, in Ayurveda, it is dushta pratisyaya. And hemicrania, ardhava vedaka, brain, because blood clots in the brain, otherwise. Then infections in the brain, then fits, loss of sensation, fainting. In all these conditions, in olden days, 2nd century itself, classically they have mentioned certain drugs. What are they? Even today, these drugs are applicable. See, these drugs can be used in a single manner. Now, what I am stressing, these drugs, you can use in a single manner, individually in the sense, or in a combination you can use it, Otherwise, you find out the formula, third point, you find out the formula where these ingredients are present, that you pluck and use it. Then you have to go for the company, that means you are depending on the companies. So, you have to find out whether the required drug framed by Charaka, father of medicine, available in that formula or not, you are supposed to find out. Or not, You have to support. It is a risky job. You require more concentration. That is why today, see, whether doctor is consulting or not, simply company representatives are coming and telling. So that means the division is developed and they are taking the responsibility of pharmaceutical productions and they are preparing the formula, they are giving the finished product to the doctors, and there is a separation between doctor and pharmacy. I will say people will think it as an interlink, but I will say as a separation. Because being a doctor, we should know the things, but today company reps are coming and telling. The days changed. That means, let us see in a positive manner, the pharmaceutical industry developed and developing. Let us see in a positive manner, the pharmacy or pharmaceutical industry developed. Now, anyhow, let us come to our point. What are the important? Just now, I have stressed some drugs, is it not? What are the drugs? In PG entrance examinations or in a practical point of view, theory point of view, Viva point of view, what are the drugs useful in Ardhava Vedaka? What are the drugs useful in Pinasa? And drugs useful in Sula, drugs useful in Apasmara, or drugs useful in Grananasa, drugs useful in fainting. See, Viva means, answering Viva will not satisfy this answering Viva may satisfy the examiner. How far we can satisfy ourselves to treat the patients is the big question. The ultimate aim of studying 5 years is to satisfy a patient. You have to satisfy the patient. They don't know how much, what we are gaining is secondary. There are different points will be there in discussion. Our point, in Viva point of view, practical point of view, theory point of view, it may come as a 2 marks question, it may come as a 5 marks question, or may come as a 11 marks question. So that depends upon the pattern, examination pattern you are supposed to select the drug. Let us see what are the important drugs available. Now I have told you how to use, when to use, clearly I have mentioned. Now let us see what are the drugs. Apamarga, which is drug very easily available. Pippali, Maricha, Apamarga, Pippali, Maricha, Sigru, Tumburu, Apamarga, Pippali, Maricha, Sigru, Tumburu. I am telling in a slow manner, in the sense you can note down the things also, so that in which manner the question comes and what will be the answer. In exam PG entrance, one of the following is mentioned by Charaka in Siro Virechana or Sears Virechana, or one of the following is not mentioned, even remain out of A, B, C, D, one is mentioned, remains not mentioned. See, the question may come in a negative manner or the question may come in a positive manner. See, concentration is very important. Blindly getting a seat is not a criteria. So, there are many ways to get postgraduate seats in India, but your aim and our aim is to crack these seats in reputed and topmost colleges in India. That is, see, the name always, the prestige institutes are prestige institutes only. So you have to think whether you have to prepare or not, how to maintain the standards, what is what. So anyhow, come to point our drugs. Okay, Pippali, Maricha, Sigru, Tumburu, and then Ajaji. It is a common drug, but name is differently mentioned. Ajaji, Kuminam, Siminam, Ajaji, Kuminam, Siminam, Yela, Pilu. What is the botanical name for Pilu? For rare drugs, I will mention the botanical names. Pilu, Salvadora persica, Pilu, Salvadora persica, Salvadora persica, Harenuka, Prudvika. Prudvika means Nigella sativa. Very important bit. Prudvika means Nigella sativa. Surasa, Osmum sanctum. Surasa, Osmum sanctum. Kuteraka, Osmum basilicum. Kuteraka, Osmum basilicum. Next one, very important bit. Phanijaka means seed of Sirisha is called Phanijaka. The seed of Sirisha is called Phanijaka. Then Lasana, Haridra, Lasuna, Haridra, Daru Haridra, Saindhava, Lasuna, Haridra, Daru Haridra, Saindhava. Saindhava means rock salt here. Savarcha means sanchal salt. Then Savarcha Ravana, Jyotishmati, and Nagara. So now they may mention the drug names and they may ask the indication. Number one, they may mention the drug name, they may ask the indication. Or by mentioning the indication, Sirsha Virechana Dravya Second Charaka, one of the following. One of the following is one in a positive manner, one of the following is not mentioned in source. That means remaining group A or out of four. Out of four, in which groups the drugs are not mentioned, you are supposed to trace out. And this will help you in practice also. And one more thing, these drugs can be used in a combination. See, Charaka clearly mentioned what are the drugs useful in brain diseases. What are they? What is what? Even today, you take the Krishna Jiraka, if you are taking Krishna Jiraka, just you take the Krishna Jiraka in a pouch and boil, just vomit and inhale the smell, heaviness of the head will come down. Really, it is a magic drug. Openly speaking, it is a magic drug. In market is it available, what we are calling generally Nalla Jelakarna. You take the Nalla Jelakarna and just vomit in a cloth, pack it and inhale it. See the smell in chronic rhinitis and whatever you say, rhinitis, pinasa, pratisyaya, dushta pratisyaya, whatever you say. For every half an hour going on doing within 2 to 3 days, you will recover very easily. The heaviness in the brain will come down. See how people will suffer when cold and cough is there, they cannot bend down the neck also. See the practical difficulty. In such conditions, simply you take this drug which is available easily and vomit in a cloth and pack it and then inhale the smell. See, the drugs works, the drug routes you know very well. I don't want to waste your time here. Apply practically, see the result. Okay, now I have told the drugs and what are the drugs in brain diseases. Of course, these have to be used in combinations. Now, it is a pharmacy is a complex subject. Pharmaceutical industry or pharmacy. But in the system of Ayurveda, the drugs have been clearly mentioned in which condition what is available. So, have they mentioned the combinations? Yes, they have mentioned the combinations in compound preparation. The same drugs will be there in compound preparations. In Charaka Sutrasthana, clearly they have mentioned 500 drugs with a specific activity. So you try. That means how many dissertations are there? 500 dissertations are there. Is it possible to complete 500 dissertations in India? Taking one drug in one subject to symptom. That means see still how much subject is there to be covered. Still how much subject is there to be covered. Just you go through it. We are not going for the college matters. Here we are stressing what are the drugs in brain diseases. What are they? If these are available, simply you take the Tulasi, which is available Kasitu Kanyakumari in the world. Tulasi is a known drug. Whatever may be the species in Tulasi, just you crush it, get the Swarsa and take internally regularly 10 to 20 ml regularly. See the result. Thrice a day you take, see the result. Now so many companies are there preparing Tulasi syrup. But why can't you try independently in our houses, in our herbal garden areas, whatever the type of Tulasi is useful in brain disease. The brain disease means not only surgery. So it is nervous system related or digestive system related. You have to find out. Without finding such facts blindly today, we are treating certain. It's not a comment. It is a question of analysis for the students' community. It is an analysis for students' community. So you sort it out. See, a person comes to your clinic for a headache. You are going for nervous system. You root out. In the root level, you start with the system. See the benefits you will come to know. So today, now what we have completed, practice well. In case of any doubts, Dr. Simhadri, 9014141722, 9014141722. For regular or online classes, you can contact. Elena Ayurvedic PG Entrance Coaching Center, Salivinagar, Hyderabad. Thank you. Today's class is over.